Morning. So when I was younger, I had a favorite aunt, Aunt Bettina. And I remember she had these really noticeable weird white spots on her teeth, like they were pretty obvious. And when I got a little older, I asked her about it one day. And she didn't tell me that she had tried some sort of weird whitening technique or anything as an adult, which is what I had expected to hear. She didn't even tell me that when her baby teeth fell out and her new teeth came in, she hadn't been brushing properly or something hadn't happened. What she told me is that when her mother first took care of her when she was a baby, she didn't know the proper way to take care of her teeth and her gums before she even had teeth, and that had caused what's called fluorosis, these white spots on her teeth. So all parents want their children to be happy and healthy. That's really one of the #1 concerns for parents across the board. And according to WebMD, one of the most overlooked things that new parents don't pay attention to is the oral hygiene and the proper care of their baby's teeth. Now, the New York Department of Health states that properly taking care of baby's teeth can prevent diseases like tooth decay, which is actually an infectious disease, and it can also prevent things like yeast infections, which can be painful for the baby. On top of that, good oral hygiene habits early in life can create better, stronger baby teeth and consequently adult teeth, and create good habits for your children all the way through their lives. So, in this speech, I'm going to demonstrate proper oral hygiene habits for a child in their first year of life. First, I'm going to demonstrate how to properly hold or place your child while you're taking care of their teeth. Second, I'm going to demonstrate how to take care of their gums before they have teeth. And thirdly, I'm going to demonstrate how to take care of their teeth as their teeth start to emerge. So, the first thing you're going to need to know is how to hold the baby. Now, babies are relatively fragile, and you always want to make sure that you're holding their head. You also need to have both hands free really in order to do this properly. So you don't want to simply hold your baby and clean their teeth. The best way to do this is actually if you can sit down and you want to sit cross-legged. Now when you sit cross-legged like this, you can place your baby's butt in your lap like this and rest its head on your leg. This gives it support, and you also have this front leg free, which can potentially prevent it from falling or slipping or anything like that. So you want to make sure your baby's secure. This gives you both hands free in order to properly do their teeth cleaning, and at the same time it makes them feel comfortable because they may not be used to this process. Even if you do it regularly, it may be uncomfortable for them, so it gives them the contact comfort of being held, which is important. Also, you want to be able to talk them through this process and tell them kind of what you're doing, let them hear the calm in your voice as you're going about this. So another good way to do this, and especially if you're on the go or something, is you can place them in a car seat or in any type of baby carrier like this. Now, you want to keep in mind that babies don't know the difference between swallowing and spitting. So you want to kind of let gravity work for you a little bit. You don't want them swallowing too much. So you want to always have their head propped up a little, as in the example with the knee. So when you place them here in this little carriage, you have their head propped up, and you do want to make sure that they're properly strapped in, whether this is a car seat or a little baby carrier of any kind. And this is beneficial because it gives you the ability to walk around, to get things if you forget them, any of that. However, it doesn't give them the contact comfort of being held necessarily, so it really depends on if you're on the go or what your preference is, what's more comfortable. Now, if you have 2 parents available, there's a great technique that actually works really well both when they're small and when they become toddlers later on and they become a little more squirmy, and it's called the knee-to-knee technique. So what you're going to do is you have 2 parents, each one's going to be sitting in a chair, and they're going to be sitting knee to knee. So imagine there's another person right here sitting in the chair knee to knee. Now, one parent is going to have the baby's legs and butt sort of supported on their knee, and they're the ones who's going to be taking care of the baby, watching it, while the other parent is completely free with the baby's head on their knee, propped up a little bit, and that parent is going to be the one doing the teeth cleaning for the baby. So for this demonstration, I'm going to be placing the baby here so that I can show you guys a little bit more specifically what I'm going to be doing here. So now that we have our baby properly placed, I'm going to be showing you how to take care of their gums before they have teeth. Now, it's actually relatively simple. You can use either a very soft cloth, or what they recommend is that you use a piece of gauze. So you're not going to need very much. I'm going to cut a piece of gauze off here, maybe about this big. This is all you really need. And what you're going to do is you're going to actually wrap this gauze around your finger like this and get it. You're going to have a small cup of water near you or a sink or something. and you're going to want to simply, get this gauze a little bit wet and make sure you wring it out because you don't want to have too much water again because the baby's probably going to be spitting up. Now before you actually start cleaning, you probably want to put a bib on them just because there's a good chance they will spit up and you probably don't want to get their clothes dirty. So I'm going to use these gums to model. So really simple, what you're going to want to do once you have this gauze is you're going to want to make sure you first get the tops and bottoms of their gums right around there, just as if where their teeth are going to be coming through. And you might have a little bit of milk scum or something on the gauze, so you want to then again rinse it off in the water, make sure it's not soaking wet. You want to make sure you get in front of their lips, the very front of the teeth here, all the way to the back, and again at the top, and also behind. If they'll let you, you can also get their tongue, if they let you. So once you have that done, you also want to make sure you're checking for any types of infections. Now, you'll get to know your baby's gums relatively well. So as you're feeling around the gums, if you notice any types of bumps or anything like that, it's not necessarily something to be alarmed about right away, but you do want to pay attention to it. Any type of brown spots could indicate potential decay, especially as they're teething and their teeth are starting to come in, and any white spots might indicate some type of yeast infection. If their gums become red, that could be a sign that they're teething, so it's nothing to be too alarmed about. So now that you know how to take care of their gums, I'm going to demonstrate how to take care of their teeth once their teeth come in. So once the baby starts having teeth, it's a little bit more work just because you're still going to be using your gauze. So that piece of gauze that we had before, you're going to be doing the same thing that we did before, dipping it in the water, cleaning off the parts of their gums. But their teeth you want to take a little bit better care of, starting to use a baby toothbrush. Now, they have these toothbrushes at pretty much any store that has baby supplies. You can get them at Vaughn's, Target, anything like that. And you'll notice the head is very small and the bristles are quite a bit softer. You're also going to want a baby toothpaste, and this toothpaste specifically does not have fluoride in it. Now, fluoride is a natural tooth decay deterrent, and it actually occurs naturally in tap water, but ingesting fluoride, since babies will likely swallow some of what you put in their mouth, is what causes that fluorosis. So you want to make sure you're avoiding that. And when you use the toothpaste, you don't want to blob it on like you do. You just want to use like a tiny smear. So small you can barely even see it. I mean, that's like the size of, something very small. So you don't want to use very much. And when you actually go about brushing their teeth, you're going to want to make sure that you're doing around their teeth, you get the toothbrush a little bit wet, and you're going to want to make sure you do small circular motions on their teeth like this. So make sure you get the fronts and backs of their teeth and just, do small circular motions, and they will get used to this. And once you start brushing their teeth, you do want to make sure that you're also brushing their tongue and preventing bad breath and stuff like that for your baby. So again, make sure you're checking for any types of infections. And then you want to, if they spit up at all, you want to be able to have towels or any types of baby wipes available in order to clean their mouth. Now, the American Dental Association recommends that babies within the first 6 months to a year of being born should actually have their first dental visit, because that gets them started good and, lets you become aware of any potential problems, which you should be aware of anyway if you're doing regular maintenance on your baby's teeth. So, you now know how to properly take care of their teeth as they emerge. In today's speech, I've demonstrated the proper oral hygiene for a baby in their first year of life. First, I showed you how to properly hold or place the baby to take care of their teeth. Second, I showed you how to properly take care of the gums before their teeth emerge. And thirdly, I showed you how to take care of their teeth as their teeth begin to emerge. So now that you know how to do this, you can avoid things like the fluorosis my Aunt Martina has. You can avoid potential painful problems for your baby, such as decay and yeast infections. And most importantly, you'll be able to teach your baby good oral hygiene habits that they will be able to take with them for the rest of their lives. Thank you.